Hi, I'm Dr. Sunita Pawar, Senior Consultant, Obstetrician and Gynecologist and Infertility Specialist working at Cloudnine Hospital, Sarjapur Road, Bangalore. Ovarian cysts are very common in reproductive age. When you are planning for a pregnancy or you are pregnant, you should routinely do your ultrasound done. In that, we can find what type of ovarian cyst you have and what is the size of ovarian cyst. Different common ovarian cyst you find is a simple follicular cyst, simple ovarian cyst, either hemorrhagic cyst, dermoid cyst, endometriotic cyst or any complex cyst. If the cyst is more than 10 cm, then we advise you to go for a CT or MRI because we have to rule out the malignancy. To confirm the cyst, we do the repeat sonography because some cysts like the simple follicular cyst or the simple cyst or hemorrhagic cyst, it may disappear in 3 months. So if you have a simple cyst or the hemorrhagic cyst, we may advise you to repeat scan after 3 months. But if you have an endometriotic cyst or dermoid cyst or any complex cyst, it will not disappear on its own. You may need a regular evaluation with ultrasound and with the symptom. Especially with endometriotic cyst, you may have a pain, either the pain during defecation, heavy menstrual pain that is called as a dysmenorrhea, or you may have pain during sexual intercourse. So we have to always see what type of cyst you have. Endometriotic cyst may cause adhesions between the ovary and tubes and the posterior surface of the uterus or any other part in the abdomen. You may have infertility. So we have to always rule out what type of cyst you have. Usually, this cyst may not cause any complication, but if the cyst is more than 5 cm, there are chances the cyst may undergo torsion. That is, the cyst may twist. That is the time you may have a severe abdominal pain or the lower back pain. You have to immediately go to the doctor. Torsion, we have to immediately operate. We can do with the laparoscopy. We can do either we have to go for a complete removal of the ovary, that is called as a oophorectomy, or we may just remove the cyst. One more cyst which have this emergency is a corpus luteum cyst. Sometimes this corpus luteum cyst can rupture and that is the time you will have pain. You have to immediately go to the doctor. Corpus luteum cyst also, we just aspirate the cyst and we operate the cyst. So whenever you have pain, you have to immediately go to the doctor. Sometimes ovarian cyst, you may not have any symptoms. These are totally asymptomatic. Sometimes you may have menstrual irregularities or the lower abdominal pain, pain during defecation or pain during intercourse. So whenever you have these symptoms, you have to consult your gynecologist, get your scanning done, find out the type of cyst, the size of cyst and the treatment of the cyst.